Hi, I'm Jonathan DeRuzzo, MD from Revitalize You. I'm here to talk to you today about a subject called hormone replacement therapy. You may have seen it be mentioned in the news and the media, maybe even some of your friends have been talking about it. And essentially what HRT is, it refers to hormone replacement therapy. Okay, hormone replacement therapy is referring to normalizing your body's levels of chemicals, hormones, specifically the sex hormone testosterone for males, which modulates and is responsible for many varied functions in your body. You can know, or you can expect to know or feel that you have low hormones, low testosterone, by some symptoms such as fatigue, loss of muscle mass, body fat increase, sex drive decrease, things of that nature, are all indicative of having low hormones or low testosterone state. So the question arises, how do you know if you have low hormones? And in addition to those symptoms that we just discussed, fatigue, weakness, loss of sex drive, we do a thorough analysis, a blood analysis that determines your levels of testosterone that can be measured in your blood. There are two frequently measured parameters of testosterone. Number one, serum testosterone or total testosterone, and secondarily, free testosterone. We utilize the free testosterone test as an additional test that can determine whether or not you have hormones or proteins in your body that will bind the regular testosterone, making it ineffective. So how does low hormone or low testosterone affect your life? And typically what a male experiences when he starts to get into his mid to late 40s is just a general decrease in his enjoyment of life. Decreased motivation, decreased sharpness, decreased aggressiveness, decreased ability to perform in sexual activities, and just a general decrement in what we call la joie de vivre, the joy of life, just seems to go away. And it happens so subtly that many times people don't even really notice it happens because it creeps up over a period of time, until at one point in your life you'll be like, wow, things are not going the way that I thought they should be, even though they are in reality, but you just don't have that feeling. And a lot of that can be explained by an abnormality in your body's hormone levels, which is why I think it's very important for people that think that they may be suffering from low hormones to come and get evaluated to see if perhaps that is causing their problems. So, how do we fix or how do we address low testosterone? The term hormone replacement therapy obviously is referring to replacing the hormone levels that are low in one's body. And the way that we can do that is by administering pharmaceutical grade prescription medications that regulate and normalize your body's testosterone levels. Here at Revitalize UMD, we prefer to use intramuscular injections of testosterone, which is typically well tolerated, and our goal level of testosterone to have our patient's body be at is about the level that you would have in your mid to early 20s. And we found that that's the most effective for treating and addressing the symptoms of low testosterone, in addition to perhaps preventing some of the diseases that can be associated with low testosterone, such as obesity, diabetes, osteoporosis, and some kinds of heart disease. So bottom line is we address low testosterone by administering pharmaceutical grade prescription directed medications, usually by intramuscular injection over time. So, what to expect? What can a person typically expect to feel or to notice after initiating testosterone replacement therapy? Typically, in the majority of our patients, they'll notice a subtle but definite increase in the quality of their life, in their level of overall sense of well-being. Psychological effects, number one, are typically what happen. Secondarily, after that, they may notice an increase in the amount of positive aggressiveness that they're displaying in their life, competitiveness, but positive in their workplace, at the gym, motivation, so to speak. Sexual improvement in their sexual well-being, their sexual performance, and their sexual relationships that they have, the intimate relationships that men may have in their life will also often increase, which can be very, very beneficial, especially in the home life. There are occasionally side effects that happen, such as increased blood volume, increased retention of water, that we see rarely, but that can often be addressed. But typically, overall, the therapy is received very well and seems to have a much greater positive effect than any rare cases of negative side effects. Okay, so how do we start the process? If you're interested and you think that your testosterone levels may be low, that it's negatively impacting your life, how do we get all this stuff rolling? Very simple. First of all, we'll do a screening laboratory test. We'll take a small sample of blood, send it off to our lab, and see what your hormone levels really are. Typically, men with symptoms, I found, will be around in the 200 to 400 nanograms per deciliter range. If your levels are anywhere below 400 or 500, that could definitely explain the symptoms you're having. So it starts with a small blood draw, a small laboratory test. After that, if your levels are low, we'll have you come in for a more advanced, more comprehensive screening to make sure that all your internal organs are working properly, kidneys, liver, etc. Make sure your blood count is within the healthy level, and there's no contraindications, or there's no reason to not continue with therapy. Once your health is checked out from that aspect, we'll have you come in and see one of our licensed medical professionals. Our nurse practitioner, Ms. Brazier, is very qualified, very competent. She's very eager to help. This is one of her great joys in life is anti-aging therapy and hormone replacement therapy. Or you'll see myself, and then we can do a physical exam, get a little better idea of who you are, and see if possibly hormone replacement is a good fit for you. If all of that checks out and everything looks to be in good order, we can go ahead and we will initiate therapy, and based on your reaction to it, we can judge and determine how long you need to be on therapy, and if there's any alterations that need to be made. So essentially what it is a small blood draw, a comprehensive laboratory evaluation, a complete physical and history exam by a licensed medical professional, and then initiation of therapy to see how you do, and it's really that simple. So based on some of the things that we talked about, some of these symptoms, some of the problems that a lot of men experience in their lives in terms of energy, motivation, and your general joy of life, as well as sexual well-being, if you think any of these things are bothering you, that you could potentially have low testosterone, I encourage you to please come in. It's a quick and easy evaluation, and it could potentially change your life. Based on what I've seen with many of my patients, they tell me routinely that if they'd known, they would have started years ago. So I highly encourage you to take control of your life, be proactive, and if you're having a problem, address it, get it fixed, because there is help, and we could potentially help you quite a bit. Coming in, Revitalize UMD, and see if we can help you out. Thanks.